I'm Dr. Michael Wax. I'm the surgical director of liver transplant surgery at Children's Hospital Colorado and a professor of surgery at the University of Colorado Medical School. So the options for children are the same as for adults, but the size considerations are a little bit different. In general, deceased donation is when we take an organ from somebody who passes away, and then those organs are offered to the children according to their level of illness on the waiting list. There's a scoring system called the PELD, P-E-L-D scoring system that determines the level of illness of the child and whether or not they are offered the organ, the deceased donor organ. Once the child's offered that organ, then we have to determine whether or not the size is appropriate, which is really the biggest consideration for children, is finding a liver that's not too big and not too small. Sort of the Goldilocks hypothesis, in that we want it to be just right. And so because there aren't a lot of small children who die and become organ donors, which is a good thing, very often we have to take a piece of the deceased donor liver in order to make it fit into the child that we're transplanting. So the two options from the deceased donor list would be to use a whole organ from a small child to transplant into a similar sized child, or to use a portion of the liver from the adult deceased donor and then split it into a segment that's the right size for the child that we're transplanting. Sometimes we can actually transplant two recipients with one whole deceased donor liver, so we can do something called split liver transplant, where we take the smaller segment for a baby or a small child and then use the larger segment for an adult. Fortunately, working with Donor Alliance, who's our organ procurement organization here in Colorado, they have a organ recovery center, so we can actually move a deceased donor to that organ recovery center and then use the same equipment that we use when we're doing a live donor transplant to split the liver in the deceased donor, and then use a portion of that split liver for a child and the other portion for an adult. So having those facilities here in Colorado allows us to do that organ recovery and the split donor recovery in the fashion what's called in situ, inside of the donor, before all of the organs are flush with the preservation solution. So it allows us to do it much more accurately. They also have a CAT scan that they've provided us so that we can know the anatomy ahead of time. So it allows us to do the operation much like we would do in a living donor operation, and allows it to do it more accurately and define the anatomy better for the child. So live donation, the advantage is that a child can be transplanted more quickly because they don't have to wait to get sick enough for their PELD score to bring them to the top of the waiting list. So the biggest advantage is that you can take a child and transplant them before they get very sick, which means that they're going to probably do better through the surgery and then recover faster and have a better chance at a good outcome. The downside of live donation is that you have to take a healthy person and put them through surgery to get that segment of the liver from the donor to be able to use for your pediatric recipient. And that not every child has a live donor, so that there are families where there's nobody young and healthy enough that can come forward, or the appropriate blood type that can come forward and be a living donor for that child. Fortunately, here in Colorado, we have a non-directed live donor program. There are several others around the world, and even a few other smaller programs in the country, but the non-directed program in Colorado is, as far as I know, the largest non-directed program in the United States currently. And what I mean by non-directed is that somebody, out of the kindness of their heart, comes forward and says they want to be a live organ donor, and they want to donate. They can either donate a kidney or a portion of their liver to somebody that they don't know. We have a great relationship with the University of Colorado and the adult program, who does the donor surgery and the donor evaluation. Dr. Liz Pomfret is the head of that program, and she's really worked hard to develop this relationship with Children's Hospital, which has really benefited our program, because a lot of the children on our waiting list don't have a live donor. So with the non-directed program, we're able to find a donor for them and then get them transplanted sooner than they would if they had to wait on the waiting list. It also makes sense if you're going to have a non-directed donor to have them donate to a child, because the operation to take a small segment of liver out of the non-directed donor to give to a child is safer for the donor than if we were to take a larger segment of liver, say, to donate to another adult. So in general, we like to use the non-directed donors to transplant children on the Children's Hospital waiting list. Fortunately, we've been able to make use of most of the non-directed donors that have come forward, and because of that, we've been able to transplant many of the children on our waiting list. So the transplant rate, or the waiting time that our children have to wait in order to get transplanted, is significant. It's about 50% shorter than the national average. And so because of that, we're transplanting our children, and we probably in the near future will have more non-directed donors than we have children here in Colorado to transplant. And so that really provides an interesting opportunity to go out to a larger regional or even national level to look at families and children who are maybe sitting on a waiting list somewhere else in the country. On the East and West Coast, there's a lot more competition for deceased donor organs. And so if there's a child who doesn't have a live donor and is getting sicker, there's the potential for some of those families to do what we call double listing, and come out to Colorado, be evaluated by us, add their name to our waiting list. That doesn't mean they have to leave their program and their waiting list, but they could add their name to our waiting list, and potentially, if we have a non-directed donor, we could transplant a child from somewhere else in the United States, and then as soon as they're recovered and able to leave the hospital, we could send them back to their home program and to the physicians that they know and trust, and hopefully get them transplanted if their program's having trouble finding an organ for them. So since starting to really increase the number of live donor transplants that we're doing here at Children's Hospital, that started in about 2016, where we had a resurgence of our live donor program, and Dr. Pomfret came to the University of Colorado to run the adult program. And so the combination of those two things allowed us to really increase the number of live donors that we've done. And so since 2017, we've done anywhere from 50% to 2/3 of our transplants as live donor transplants. And about 2/3 of those have been from non-directed donors. So the combination of live donor transplant in general, and then more specifically the non-directed program, has really allowed us to not only increase the number of transplants that we're doing, but decrease our waiting time and transplant children much more efficiently. One of the things I think that really makes our program unique is that we provide high-end medical care in a really small town environment, and that when families come to Children's Hospital, the focus is not just on their medical care, but really looking at the whole family and making sure that we take care of the young parents of these children. And a lot of times that having a sick child obviously can be a chaotic experience in these families' lives, and I think we're really good at really taking care of the whole family and not just the sick child. So that, in combination with the non-directed liver program, gives us a unique opportunity to provide that sort of small town feel of care with really high level of medical care to a pretty large base community. I think that still, even though we're talking about live donation, organ donation in general is still a very important message to the people who might be listening to this, that signing your donor card is important. We still rely on deceased donation for both adult and pediatric liver transplant, and so just because we do live donation doesn't mean that we want people to not sign their donor card. It's still really important to sign your give permission for organ donation when you get your driver's license, and promote organ donation in general. One of the things that is unique is that the amount of space, the tremendous campus we have here in Colorado. And if you look at a lot of the other major centers on the East and the West Coast, space is at a premium. Here, because of the amount of space and the ability to have two large hospitals right next door to each other, really, we can walk from the university to Children's Hospital in about 2 minutes. And so having such a high-powered team at the university on the adult side to do the donor surgery, but also the donor evaluation, and then having that right next door to Children's Hospital where the organ comes and we take care of the children, is a big deal for us as physicians because it makes our lives easier going back and forth. But really, I think it's a really big deal for the families because, you know, if a family is having a live donor liver transplant and a member of the family is donating at the university and at the same time the child's being operated on at Children's, families can walk back and forth easily. The hotel where a lot of these families stay is right across the street. So I think, you know, without seeing the campus here, it's hard for people to understand, but the amount of space and the proximity of the hospitals to each other really makes for convenience for families that I don't think is going to be found in a lot of other programs around the country.